just hold it.
All right.
Okay, so first thing I'm going to do is, and we're going to repeat this with you laying on the table,
Okay.
is that, so this is a spine that has been kind of apart, but we're not going to focus on that right now. But what we're going to focus on is that keeping the spine in ideal positioning is what is going to keep it strong. And I'm going to have you tilt your pelvis backwards, and so that is the same motion as if you just did that.
Okay.
And then I'm going to have you tilt your pelvis forwards like that, and that's the same thing as doing that. And going to have you do that 3 times, and then you're going to find the middle of that position. And that is going to be the key thing that we're going to want you to find. And because you like being a little bit more tilted backwards, we're going to do that same thing with it. So you're not going to be directly in the middle. You're going to find that middle and then tilt backwards just slightly. And that is going to be where we want you to stay. Okay, so now I will take the camera.
Okay.
Okay, so now go ahead and lay on your back, please. So, like I said, the first thing we're going to do is we're going to find ideal positioning. And to do that, you're going to lay on the floor or put your back against a wall or a piece of machine or a tree, whatever you can do, because you want the tactile sensation. Okay? So, on the table and on the floor, you're going to bend both knees. So, go ahead and bend both knees. And then you're going to want to line up the heel, the knee, and the sit bone so that they're kind of straight. And you should feel like your feet are in a wide, strong stance, like not too skinny and not too wide. Okay. And then like we talked about when I showed you the spine, now you're going to tilt the pelvis backwards and forwards. And go ahead and do that 3 times. And then find what you feel is the middle position. Okay, and then if you want to, you look like you already tilted backwards a little bit. If you want to, you can tilt backwards or you can stay right there. But whatever position you decide that you want to stay in, you need to try and stay in it. Okay? Does that make sense?
Yes.
Okay, so then hands at your sides. Think about shoulders being really nice and wide. Okay. I'm going to put this down a little bit here. And then back the neck nice and long. So not like that, more like this, like kind of you're tucking your chin, like that. Okay, so that's the alignment. Now I'm going to teach you something called the powerhouse. The powerhouse is a combination of 3 things. First, contracting a deep abdominal muscle called the transverse abdominis. Second, contracting the muscles of the pelvic floor. And then third, the breath. I'm going to start with the breath. The breath is first in through the nose, out through the mouth. So it's going to look and sound like this. Shh. Can you show me? And when you do the shh, you want to make a sound like you're trying to tell someone to be quiet, kind of a shh. So try again. Excellent. Perfect. Okay. Now abdominal muscles. So now here we have the rectus abdominis, the most superficial abdominal muscle, the abdominal oblique, named because it goes obliquely across the abdomen, and then the one we're concerned with right now, the transverse abdominis, goes across the lower belly. And what that muscle does is that muscle draws the lower belly back towards the spine. So if you take 2 fingers right here, so use your left hand, you feel this pointy hip bone right there, you roll just to the inside. I'm going to do the same thing on this side. So now what I want you to do is I want you to take that breath in. And as you breathe out, shh, try and draw the lower belly back towards the spine. Keep pushing. Shh, keep going, keep going. Good, right there. You see, you felt what you had? See if you can get that back. Keep going. Breath in. Shh, keep pushing. You need to push more air out. Keep going, keep going. Push, 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 push. Feel that. That's what we're looking for. Breath in again. And again. Shh. Push, 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 push. There it goes. See if you can make that happen a little bit earlier. And then again. Shh. Push, 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 push. Okay. Now the muscles of the pelvic floor. Pelvic floor sits here. Urethra, what we pee through, and anus, what we poop through, both pass through that muscle. When you contract that muscle, it moves up towards your head, and it takes penis, testicles, and anus with it. 2 cues to help people get connected to their pelvic floor muscles are: 1, stopping a pee in the middle of peeing, but we don't want people to do that on a regular basis because that does promote urinary tract infections. And the other one is holding in a fart. Can you contract your pelvic floor muscles? Okay, so now we combine all three. So now it's breath in, breathe out, draw the lower belly in, lift the pelvic floor. Good, and you feel how this contraction is a little bit better when you add the intention of the pelvic floor. So breath in again. Breathe out, draw the lower belly, pull. That's getting much better. That's what we're looking for, is that this contraction to get even stronger and more powerful. Okay, let me see. We're recording again. Okay, so now you found all that nice engagement, heels, knees, sit bones. You've tilted the pelvis backwards and forwards 3 times. Shoulders are nice and wide, back to the neck's nice and long. Now you're just going to take a test breath in, breathe out, draw the belly in. Shh, no movement. Shh. Lift the pelvic floor. Okay, on your next breath out, you're going to bring the right leg up into tabletop. Leg comes up, and that's perfect, but only right to there. Okay, and then breath in, engage, leg comes down. So right to that same position. Okay. Again, we only want to move one joint, so the knee joint doesn't move, only the hip joint. Okay, now go to the left leg. Breath in, nice engagement, leg gets picked up. Perfect. Breath in, engagement, wait a second, and then bring the leg down. Good, back to the right leg. Breath in, tighten everything, pelvic floor, transverse abdominis, leg comes up. Awesome. Breath in, engage, okay, breath in, engage, leg comes up. You're going to do this 10 times each leg, okay? Breath in. Okay, so I go up and down the same way. So it's breath. I find all that nice alignment. Shoulders back and wide, back to the neck nice and long. Then my pivot happened at the hips. I keep this nice and straight. I'll get totally on my side. Then once I'm on my side, engage again, and then on to the back. And I reverse it to get up. So it's okay?
Okay. Good.